Good evening and welcome to this first online session of Crack the Wellness Code. I'm Somnath Chatterjee, co-founder, and very excited about today's program. We are honoring our nurses who play such an important role for the community. The World Health Organization, WHO, is estimating a shortage of 9 million nurses worldwide. And that's something which is going to create a lot of pressure on our healthcare system. And today we are going to, cover a very important topics, and we have two very accomplished nurses who are, PhDs and MBAs, and they also uh, play a very important role in the Bay Area network of nurses called BINA, with whom CWC is entering into a partnership. They have a network of nurses all over USA, and through them, we're actually going to reach out to our community. So it's a great move by BINA and Crack the Wellness Code to serve the community. So without much ado, I would invite Dr. Sachin Deshmukh, who has been advising our elder track in Crack the Wellness Code. Sachin has been with me for more than 150 of the 220 events that we have done in Crack the Wellness Code. So thank you, Sachin, for that. He advises the senior track, and he has a large following among the elders. He's a dedicated yoga practitioner, yoga grandmaster, and he has been focusing on holistic health. So over to you, Sachin, for introducing our speakers and get us started for this thrilling event. Thank you, Sachin.
All right, thank you, Som, and welcome everyone to this wonderful evening for the program. We are very excited to represent the nursing aspect of the program for the seniors, and we are very happy to present the knowledge from two esteemed, wonderful speakers we got, Dr. Veena Wangari and Dr. Sejal Naik, who are going to share some wonderful ideas and also takeaways, practical points for our benefit. So we will start with Dr. Veena Wangari. Dr. Veena Wangari, as you see, she is very experienced nurse executive. She has over 20 plus years of leadership experience in nursing, hospital administration, chief nurse, rehabilitation service. She works with Veterans Affairs, Palo Alto Healthcare Systems. She also has very diverse credentials. She has BSN from SNDT Women's University, Doctors of Nursing Practice from Baylor University, MBA, then Masters in Sociology and Postgraduate Diploma in Hospital Management. She is Certified Healthcare Leader, Certified in Rehabilitation Nursing, called as CRRN, Healthcare Accreditation, Risk Compliance Governance, and Healthcare Quality. Professional leadership, she is also Secretary on the Emergency Medical Care Committee, San Mateo County, board member, Sigma Theta Taus Omicron Omega chapter. He is also a nursing advocate, champions health awareness and empowers nurses to drive change within and beyond hospital settings. Also community engagement as executive vice president. The BINA is a nursing association for the Bay Area, chapter of the National Nursing Association. Also fostering culturally competent care and nurse empowerment. So as you see, it took me a while to go through all of her credentials, and they are not all represented. We are very thrilled to have her join us on this panel, and I welcome Dr. Veena Wangari.
First of all, I want to say thank you to Mr. Som and Baina, as well as all the others who have worked behind the scene to make this happen, and all the people who are joining. I really appreciate the time. And as we did a little poll, I was just observing that 50% of the people actually are beginners. I'm going to go ahead and share my screen. I'm not going to go ahead and discuss more about what we're going to talk, but I want to do a little disclaimer. I have nothing to disclose. And whatever conversation we are going to talk or discuss, it is basically health awareness, education, and giving more of the information to everybody. So there is nothing that we are. If you have some medical emergency or issues, please contact your PCP, or if you have emergencies, contact 911. So just want to make sure that I discuss that before we go ahead with the conversation. So, as the topic has been discussed with everybody, we are going to talk about nursing services. It's going to be very preliminary, as this is the first interaction with the community, and it's a collaboration between CWC and Bena. What we are trying to do today is myself and Dr. Sejal. We are trying to connect with the community and let you guys know what nursing was, the role of nursing, what we are able to support, what is our role actually in the community as well as in the hospital, so that everybody just understands what we are able to do and how we can support the community in different ways. So these are going to be my objectives for today's conversation. I'm going to talk about early recognition of healthcare needs, adopting healthy living practices, understanding chronic disease management, and self advocacy. From my understanding, today's conversation is really geared towards the elder track, and majority of our elder population really are the struggling with chronic disease conditions like asthma, diabetes, hypertension, arthritis, and so that's why the most of the conversation is going to be geared towards that, as well as certain things with the different medication management, as well as making sure that everybody knows how to advocate for themselves and be able to discuss their needs, so that everybody is able to kind of speak for themselves, make their needs known, and have the understanding. And I think the process will give you a little bit of understanding as to what tools you can utilize so that you are able to be heard and where to find that information. So the first thing we are going to talk about is health monitoring and assessment. The most important thing is, as we are aging, it's not just for people who are older but even younger people. I think most important thing is to understand what is the how to recognize the early signs and symptoms of diseases. Like, mostly we see a lot of things for monitoring and assessment. Now we have a lot of wearable devices, like you have iPhone, iWatch, that helps you understand, like, your heart rates, your arrhythmias, if you're hypertensive, different movements, your activities when you're walking. It gives you a count. When you're sleeping, it gives you how many hours you're sleeping. This just helps you understand what is your baseline health data. And everybody must have seen that people use patch called as Dexcom, that helps people understand where is your blood sugar levels. And though a lot of diabetics are using it, but as as you're seeing in this age, a lot of youngsters are also using this, so that they want to see how healthy they are eating, how much carbs they are eating, how their blood sugar goes up and down. So it's very helpful for people to really understand in an early time where their blood sugars are. The next is about the hearing loss, making sure that early you understand what's going on with your hearing loss, because sometimes the hearing loss can also be looked like if people are having dementia, because you really need to understand the difference between, is somebody having difficulty in hearing, or are they really just having difficulty in understanding. So making sure that there is a regular checkup to understand what's going on. And the last but not the least is about the other things, is about the dementia. And this is something really understanding, knowing that people are actually moving towards poor coordination, poor collaboration, poor judgment skills, and just understanding that in an early phases is also important. The other most common thing is about the joint pain and falls. You see people having a lot of joint pains, complaining of swelling, complaining of difficulty walking. Those are the things that you have to really watch to see if they are moving into some bone disorders and arthritis, so that we are able to kind of uh, understand what's going on in their life. And this would be something that will lead to different uh, things that will be causing. And I think the more monitoring is done, it will help people to actually prevent diseases, so that you're not actually going into another situation. you know all the early signs and symptoms. We also want to make sure that you are able to educate yourself as well as your family members on how can you promote the health. I think the first picture that you see over here is really self-care is very important, making sure that this picture really reminds us that when you have something you really have to pour in yourself. And I think this example has become very common now when in the flight you say that mask yourself before you take care of somebody else. So it's really important that each and every person, whether they're young, adult, or elderly, take care of themselves, so that if you are able to making sure that you are healthy to continue your journey. Healthy diet, which is very common these days, to ensure I'm also making sure that I'm watching the time, that I'm not boring everybody. 50% of your vegetables, 25% of your protein, and 25% of the carbohydrates. Just looking at your plate, what you're eating, and making sure that you're eating in an appropriate manner, and having those rest periods, the sleep, making sure that you're resting well, you're exercising well, appropriately, and positive thinking positively about yourself, having more interaction with people. I put a sign over here of meditation. Everybody has different faith and different spiritual feelings, and how they interact with the universe, Almighty, God. I think that's really important for people to get connected so they're able to feel in themselves more empowered. So it's very important for them to have that connection, to have that well-being. The other thing is vaccination, and I won't go into detail because my colleague Dr. Sejal is going to discuss more about that. And then, but that's very important for us to make sure that you are actually keeping yourself covered from all the different various diseases. Social interaction, though we say that social interaction is basically talking to people, connecting with people physically is definitely most important thing, but also there are apps, there is Facebooks, there is uh, uh, chats and other things. It connects people so that you're mentally really feeling that somebody loves you, somebody takes care of you. It's also extremely important. The other thing that we are going to talk about is the chronic disease. So if you've taken care of it, life happens, people still fall sick. You've taken care of everything, but as the body ages, our metabolic rate goes down, your health deteriorates and things happen. So there are so many conditions that as you age, there's high blood pressure, there's high cholesterol, there's arthritis, coronary artery disease. So all these conditions come into people's life. So most important thing is like uh, when you are in these situations, I think as we are just going through this process, understanding that you have educated yourself to educate, understand management of that condition is important, because you cannot just say that yes, we did prevention, but things happen in life. People do fall sick, people do have arthritis, they have depression, they have dementia, they have COPD, they have heart failure. How do you kind of continue with your life, take good care of yourself? And I wouldn't say you can reverse. There are times that you can reverse, but you also learn to manage your life and still live a very uh, productive life, so that you're able to connect with your community and your family, and are able to be more productive in your life. The most important factors when you're dealing with the diseases is ensuring that you're having your regular checkups. Commonly, it's annual checkup, but if you are sick, then you need to do more often checkups to make sure that you're connecting with your uh, practitioner, checking with them, understanding what's going on. The bigger concern is when you are sick and when you're having so many medications. Polypharmacy is a big topic. We can actually talk about that an hour, but it's really important to make sure what time you're taking your medications, who is helping you take the medications. As you know, when people are aging, they have sometimes difficulty in hearing, they sometimes have low vision, and then all these actually adds up. And sometimes instead of taking one dose, they might take two doses, or they might take too many doses early in the time. So all this adds up. And the other most important thing is the interaction with the medications. So when medications interact with each other, simple thing like green tea, and if you are on a blood thinning medications, what happens is they interact. The medication for warfarin, it actually does not have a better action. So it's does not, anticoagulation doesn't work very well. So these simple things can actually cause more problems. If you are on a paid medication, and if you are going for any surgical procedures, if you are on warfarin, and if you are on pain medications, then again, like an Advil or other things, and warfarin can again have more, there is more possibility for you to have more bleeding. So these are things that you know need to make sure that you connect with your physician and have them review your medications to ensure that you're doing the right thing. There is a little video that I would like to show before we move on. So just wanted to give everybody an idea about the medication management and ensure that once once people are in medications and that they're on several medications, ensuring that the family members or the caregivers have the ability to work with the senior members or the elders to ensure that they are able to um, put the medications correctly, are storing the medications in the right manner, are able to actually keep a log of the medications when required, and also having some kind of tips to ensure that they are, when they're going from one location, like from the physician's office to the doctor's, to a different doctor, what medications they're taking, if they're going for a procedure, if they are on certain medications, and if they have told to stop certain medications. And after the procedures, some of the elders are actually transferred out to a nursing home. That's where actually the gap occurs and the medications are missed, and sometimes some of the symptoms just come back. So I think it's very crucial for the family members also to be on top of the medication list and have a medication list available and ready, and keep it updating it regularly after a physician's visit is over. The next, we're going to talk about advocacy and coordination of care. As we just talked about recently about the medications, patients and family members are really critical in taking it, in informing what's going on, like the patient as well. I mean, the elders, being a nurse, I always talk about patient. I think I'm talking about our family members, our parents, our grandparents, as well as anybody in the community. They need to speak up for themselves, but there are sometimes barriers. It could be a barrier with the language. So we also need to know that there are translation services available to ensure that they what they speak is exactly converted, because sometimes how people speak is not exactly translated correctly. So having that abilities to ask for translation services, so there should be some ability for people to say, I don't speak the language, can I be able to get the language service line available? So those things are available for patients. The other thing is also explaining what medications they are on, where is the problem, what are they suffering from, and also having the rights, because all the people have their own rights. If they prefer not to have a treatment from a particular provider, they can say that I do not wish, and they can actually move to another provider. So making sure that people know about that. The advice nurse, that's where I think the nurses come into play. Everybody has a insurance card. Most of the insurance companies provide free advice nurse line available. So calling them, asking for advice, but there are also advice nurses in the physician's office, in the hospital, to ask questions, to support them. And most of the nurses or the care coordination nurses or case management nurses are the ones who are actually the I would say they are kind of the center of ensuring that the patient is taken care of, or the elders or the family member is taken care of in the hospital and around, like ensuring that their insurances are taken care of, they're getting the services they're being provided, medications are provided to them, and also are they in the right level of care? They need to be at home, do they need to be in assisted living, do they need to be getting home care services? So those are the things that are important while the person gets into transition. So this little icon over here shows that people can go from home to the hospital, to the nursing home, and to the clinic, and that these things go back and forth. So ensuring that there is people understand what is transition of care and what levels of care. If they're really acutely ill, they go to the hospital. If they're not, then it's nursing home or sometimes just a clinic visit, and they can come back and take care and be taken care of at home. This is called the elder care locator, and I think Pallavi will put the link in the chat. And the most important thing is, I think everybody should know that there is a phone number available, there is a locator, and if you open the link and you just put your zip code number or a city, it actually comes up with all the resources available. Resources like what services are available in your location where you're living, what kind of healthcare resources are there, including resources for living, as well as anything that you're looking forward to support your elders. And it's not just for elders, anybody else. So I think it's a very important resource. It's a tool. If you don't take anything out of this conversation, I think this will be a great tool to utilize once you are finished, and you can always have that link and utilize that. Ombudsman, this is an organization that's a federally mandated organization that takes care and is helping anybody who would feel that they're being abused physically, financially, or any other way. You can call them, and they will be coming and reviewing your cases. I think those are the things that are important for all our elders to know and explain. The last, I wanted to just go over a few things. Not everybody would like to hear more about it, but supportive care. Some of the disease conditions like cancer and other things, there are cure, but there are certain things that end up into something not always that we would like the way to end. And making sure that we would like our parents, our older adults, and our grandparents to have some peaceful and joyful time as they are actually transitioning into that other phase of their life. So making sure that there is home care services available for them, that they can stay at home, enjoy with time with their loved ones, and still be available at home. Support group. Support group is something that can be friends, can be family members, as well as others who are going through the same kind of conditions, like the people who have had cancers, or somebody who had had a major surgery. You actually connect with them. Counseling services and hospice, again, this is the end that nobody would really like to talk about, but that is basically a quality of life that when people feel that this is the way that I would like to end my life, it's something that you're actually working with them to ensure that it's a way of just making sure that they're comfortable as they are actually entering into more painful. So if there's pain, they'll give pain medications. If they're suffering from difficulty in sleeping, they'll provide them that kind of support. So I think those are the services that are provided. Just before ending, there's also something I want to make sure that everybody knows is called in-home supportive services that's available. So like family members are taking care of their elders, and that's a paid services that family members can be paid for. So it goes through your county and it's being supported. So work with your uh, social worker and your nursing case manager, so they'll actually support you in getting that information. um, I think that's all I had for this evening, and then I think you'll hear further from Sejal, and I'm open for any questions if you have.
Quite a bit, lot of information, and wonderful resources. Thanks for sharing with us.
Dr. Deshmukh, I just want to make sure that, I have some references towards the end on the slide,
Yes,
and just a courtesy for all the pictures and icons and links that I use so that, I'm giving the due credit for the links that I have used. Thank you.
thank you so much.
You're welcome.
So,
Sharing my screen.
so anybody has a question for Dr. Veena ji, you're welcome to put it into the question answer session, not in the chat. And she will be available to answer your questions after the second session is finished. So I would like to invite Dr. Sejal Naik now. Dr. Sejal is a infection control specialist who leads efforts to prevent infections and improve patient safety in healthcare settings. He is also a healthcare leader, infection preventionist at Kaiser Permanente, leading initiatives to improve infection control. She is also senior wellness advocate, focus on preventing infections and enhancing health outcomes for older adults. She also has very strong academic credentials. She holds a DNP in population health, MHA in hospital administration, and BS in microbiology and biochemistry. She is also committed to the safer healthcare, dedicated to making healthcare safer, effective for better health outcomes. So we are very excited to have her as our panelist today evening, and welcome Dr. Sejal.
Mr. Som, Dr. Deshmukh, Baina, and the organizers, and all of you for being here today and allowing us to share our pearls of wisdom with all of you today. I have no conflict of interest to disclose. The information I share with you is designed to enhance your day-to-day lives. It is not meant to replace any information that your doctors are sharing with you in terms of your care. So some of you may have heard that 88-year-old Pope Francis was recently admitted to the hospital as his bronchitis worsened, and he was later diagnosed with pneumonia. We are in the winter season here, and with all the respiratory viruses that are going around, it is the season for respiratory illnesses, which poses a health risk to all of us, definitely for adults. Good evening. My name is Sejal Naik. I'm a certified infection preventionist. I hold a doctorate in nursing practice in population health from the University of San Francisco, and I'm a registered nurse by trade. My objective today is very simple and twofold. I want to help you identify the risk of infections in the community, and I wanted to share some basic strategies that you can use to prevent infections. Did you know that hospital admission rates for infections are 3 times higher in the elderly? Older adults account for more than 70% of emergency room to hospital admission. And almost 50 to 70% of seasonal flu-related hospitalizations occur in people ages 65 and above. Some of the common infections that we see in the community are respiratory infections, like the pneumonia we opened up with, skin infections, and urinary tract infections. There are many more, but these are the most common infections we see where we have members from the community being admitted to the hospital. So why does that happen? Adults have chronic conditions such as heart disease, diabetes, kidney disease that all increase the likelihood of complications. They may have muscle weakness, which makes it difficult to cough out all the mucus from the lungs. As a result, the mucus can also collect in the lungs. This muscle weakness also causes swallowing difficulties, and sometimes people can aspirate on the food that they eat or the water they drink. Aspiration is basically food and water going into the wrong pipe. So instead of your food pipe, it is going into your air pipe. And when that happens, that food particle or the water droplet gets into your lungs. As you know, our mouth also holds millions of germs that are sometimes natural for them to live in the mouth. But when someone aspirates, all of the germs also have the potential to enter into your lungs. And when that happens, a person can end up with pneumonia. This is also an issue in elderly patients because we also have weak immune systems as we age, and that lowers our ability to fight infections. So we talked about the 3 common infections that we see, but from a prevention perspective, I am going to talk about general infection prevention strategies that you can employ from the house, from where you live. The first one we will talk about is vaccination, hand hygiene, meaning cleaning hands, ensuring our environment is clean, safely using the antibiotics that have been prescribed for us by the doctor, and covering our cough and sneeze. I will go into detail in each of these, about each of these elements. So, what is a vaccine? A vaccine basically is something that contains inactive antigens. So they could be, for example, a dead virus. A flu vaccine contains dead virus. When you take that vaccine, it causes an immune response in your body so that your body prepares antibodies. And when you are actually exposed to a real virus like the flu, those antibodies will remember to fight against that infection. And so that is the role of vaccine in prevention of illnesses. There are many vaccines that are available. There is the flu vaccine, the RSV vaccine. RSV is a kind of virus that also causes flu-like symptoms. It also causes pneumonia. There is the pneumococcal vaccine. There is the shingles vaccine. So there's different kinds of vaccines that are for prevention of these infections. I wanted to share a personal story about shingles. 4 years ago, my mother had shingles. It took over an entire part of her abdomen. So basically, her shingles went from the right side of her stomach and went all the way towards the back. And so this is the kind of sores that she had on her skin. And these were extremely painful. It causes a rash. My mother did not have the shingles vaccine. And so she was a very susceptible individual to get these shingles. Shingles basically is caused by chickenpox virus. So once a person has had chickenpox earlier in their years, the virus stays in the body. And then later, as we age, when our immune system is not as strong enough, this virus can come back and attack the body and cause what we know as shingles. Some of the complications are a very long-term nerve pain. In instances, it could also result in vision loss. 4 years later, my mother still has some nerve pain in her stomach area. And so the Center for Disease Control and Prevention recommends 2 doses of the shingles vaccine for all adults 50 years and older. So I just wanted to share with you this personal story about shingles and how a vaccine can prevent illnesses. Since this incident, both my parents have received both the doses of shingles virus vaccine. So the next topic I'm going to talk to you about is hand hygiene. So there are 3 truths about hand hygiene that I will share with you today. First one, we cannot see germs with the naked eye. We cannot keep our hands germ-free. So germs get on our hands by touching surfaces when you're going to the market, touching your grocery cart, touching vegetables, produce. Basically, any day-to-day objects carry germs. And we can infect ourselves with these germs when we are rubbing our eyes or rubbing our nose, because all germs require a way to get inside our body. So our eyes, our nose, and our mouth serve as important entry points. So I'm going to take this lipstick and I'm going to, just rub it on my fingers here. So what you see here, the red color, think of it as germs, right? So now when my hands are contaminated with germs and I'm going and rubbing my nose, or I'm eating with those contaminated hands or rubbing my eyes, this is going to get inside my body. And that is how people get sick. So we may spread germs to other people by touching surfaces, or we could get those germs to ourselves as well. And so the third truth about germs and hand hygiene or washing hands is that washing hands with soap and water can limit the spread of germs. If soap and water is not available, we want to clean our hands with alcohol hand sanitizer. And so when we use alcohol hand sanitizer, we want to take a few drops of the sanitizer and make sure we are cleaning all parts of our hands, all the way up to the wrist, turning it around on our fingers, going between the fingers, and actually getting into our nail pads. Some of the most common areas that we miss while cleaning our hands is the back area of our hands. So we want to make sure that when we are cleaning them, we're doing a great job of covering the entire surface with alcohol sanitizer. When you're choosing an alcohol sanitizer, it needs to have 60% alcohol. It can or cannot be fragrance free. That's according to your preference. And when you're washing your hands with soap and water, you want to wash your hands for at least 20 seconds, rub it, scrub it exactly the way I showed you, making sure each of your fingers is rubbed and scrubbed before you put your hands under the water to clean them. So we talked about what is cleaning of the hands and how do you clean hands and how often do you clean hands? When do you clean hands? Well, some of it might seem like common sense to you, but I'm still going to call it out. We clean hands before making food, before eating food, because remember that lipstick I put here, we don't want it getting in our mouth, right? Those are the germs. Those represent germs. And so you want to clean your hands before you're cooking food, before you're eating food. If you're taking care of an ill person at home, before touching any item or surface that is touched by others, and then rubbing your eyes. When you go to the grocery store, you know how the handles are sticky sometimes? Those are all the icky germs that are on those handles. So you want to make sure that you're cleaning you're cleaning your hands before you touch your face. And as human nature, we end up touching our faces every 2 or 3 minutes, maybe 8 to 10 times at least. We don't even know that we are doing that. We just, kind of go like this or go rub our noses, right? So those are all the ways germs can enter our body. Before, and you always wash your hands after, of course, using the bathroom, touching an animal, blowing your nose, touching garbage, or I like to do it as soon as I come home as well from outside. I clean, that's the first thing I do, wash my hands. Then it begs the question, what about the gloves? Because if you remember, when we were in the midst of the pandemic, a lot of people were wearing gloves and going to the grocery store, because we thought that the gloves are protecting us and keeping our hands clean. Well, in a way, yeah, they were protecting your fingers, your hands, but we would do the same things with gloved hands. So we would touch our noses with gloved hands, rub our eyes with gloved hands. So basically, wearing gloves does not replace good hand hygiene. If that makes you feel comfortable, that's great, but your risk to spread or get an infection is still there. So the best thing you can do for yourself is cleaning your hands. So I hope that helps give you a little bit of tips about hand hygiene. The next one I have is about cleaning and disinfecting. You want to identify all the frequently touched surface in your house. So for example, as soon as you enter your house, the handle of the door, the light switches, those are the frequently touched surface. So when you're cleaning, you want to pay attention that you're cleaning these surfaces as well. You always want to follow the manufacturer's instructions when you're using any kind of cleaners and disinfectants, because for some, you might want to wear gloves. You don't want all the chemicals chemicals on your hands. And you want to make sure that you're sticking to whatever the manufacturer is telling you on that instructions. The third area here is antibiotics. You want to finish your entire course of antibiotics. Why is that important? That is important because if you don't finish it, all the antibiotics are not going to get destroyed. And so, when they're not destroyed, you might feel better for a little bit, and then after a while, you might feel sick again. So you do not want to stop your antibiotics, even if you're feeling better, until you have finished the dose that the doctor has advised you. And remember, antibiotics do not kill virus. So when you have the flu, the common cold, all of those are viruses. Antibiotics are not meant to destroy viruses. They're only for bacteria. So do not ask your doctor for antibiotics for a viral infection. Okay, and when you complete the course, it's great. But if you do not complete the course, you also run the risk of having superbugs. So superbugs are special bugs that have been identified in the last 20 years or so. I mean, they've always been around, but they basically cannot be killed by even the strongest dose of antibiotics. And we want to be careful not to develop superbugs, because then we will eventually reach a time where we will not have a single antibiotic left to kill them. So you want to be very careful with antibiotics. Finish your dose just as the doctor recommended. Do not skip them. Do not stop them midway. And more recently, in the last few years, we're also seeing the emerging role of probiotics. So, some doctors recommend that you take yogurt or curd, for example, when you're, taking antibiotics, because they replace all the good bacteria in your stomach. What to do if you're sick? Well, monitor your symptoms, stay home and get in touch with a doctor. And if it is like the flu or something that is transmitted, isolate yourself and take precautions. Follow all the recommendations from your doctor. I'm going to show you how to wear a face mask, because that is so important in today's day and age, how we protect ourselves. So clean the hands like I showed you previously, right? How to do hand hygiene or clean your hands. Once your hands are clean, what you have here, what I'm showing you is a face mask. You do not want to handle the face mask, touch the inside of the face mask, because that is the clean part. So once you've cleaned your hands, you lift the face mask from the loops here, apply it to your nose or your face, and make sure you put the ear loops around the ears. Your face mask should cover your nose and it should cover your mouth, go all the way under your chin. Many times I see people wearing a face mask like this. This is no good. This does not help you prevent infections. This definitely does not help you prevent infections, because the two places from which viruses can enter your body, the nose and the mouth, is exposed. So when you wear a face mask, you want to make sure you cover all of that. There is a little place here where you want to press so that you have a good seal. When you don't press, when you don't wear it all the way under your chin, you will have little gaps here that will expose your, your mouth and your nose to the germs. So this is how you will wear a face mask. Now, you will keep the face mask on when you need to. Let's say you want to remove the face mask. You will start with cleaning your hands first. You will never touch the front of the face mask, because the front of the face mask is contaminated. It is contaminated from people who are in front of you, people who are talking to you. So when you touch the front, you contaminate your hands. And remember what I said, when you rub your eyes, rub your nose, you're getting it all inside your body. So once you clean your hands, you want to lift your mask from the loop here, from the ear here, and lift it slowly, ever so slowly, and pull it out, wrap it up like this, and throw it in the trash can. I hope you were able to see it. But you never touch the outside or the inside of the mask, and you just throw that face mask. And a very important point, after you throw a face mask, you want to make sure that you have cleaned your hands again with the alcohol sanitizer or with soap and water. So real quick, in a nutshell, these were the steps I showed you, where you clean your hands, do not touch the face mask, put it on through the ear loops, and then do not share your face mask with anyone. And then the last slide I have here on taking it off, you want to make sure you clean your hands, touch your face mask only from the ear loops, pull it out. Do not touch the front because that is contaminated. And then you throw it off in the trash can, and then clean your hands. For those using reusable face mask, you fold the mask and you put it away. You could use a Ziploc bag or a brown bag if you want. And then you can put it for wash that evening. So you could, wash your face mask if you're going to use it every day. So that's about it. That was all my slides I have today to share with you. And I hope I was able to share a few helpful tips with you today. I'm really excited to take your questions. I'll go ahead and stop now.
First question is, what is the most common cause of dementia? Who would like to answer that? Maybe Vedaji will.
Yeah, the most common cause of dementia is as people are aging, the neurosynapses get the issues, and then the anticholinergics actually gets lower and lower as they age. So that's one of the reasons that you see that there is dementia. There's poor ability for people to make the decisions, ability to think, ability to do most of the things that they were doing very commonly, like simple things like remembering the addresses, remembering their own names and stuff like that. And I think once that phase happens, so that's mostly common. Is there any other specific things that they're looking for?
No, that's a very generic question.
Dr. Vangari, can I add a few things?
Yes, please.
So having taken care of my father-in-law who had Alzheimer's for the last year, and he passed last year, one of the things we learned that Alzheimer's can cause the dementia as well, and there's different causes for it. It could be genetic, but it could also be exposure to infections sometimes. There's different factors for it. But I think what we can do is delay the onset as best as we can by eating healthy, not smoking, not drinking alcohol. We can have more rich diet, fruits and vegetables. Very important, we can promote socialization. Because from my personal experience, I will tell you, we were challenged because of the pandemic. And that was the time when my father-in-law's Alzheimer's and dementia got really bad. So I think keeping those social connections, my mother plays Sudoku, but there are so many other things that we can do to keep our neurons firing regularly. So those are some of the practical things we can, engage in to delay the onset.
As she said, I just want to add on, there's a research going on with Stanford, and what is being very commonly seen is some of the countries, the dementia doesn't come on very early, but if you're seeing in the United States, I think there is a lot of things that she talked about. Diet really plays a big role in how the brain functions.
To ask you a question, that after washing hands many times, in the senior age, the biggest problem is the dryness of the palm.
Yes.
So what can they do? You have any tips for that?
Yeah, that is very true. And honestly, we share similar problem only because as nurses, we're always cleaning our hands when we see patients. So we definitely use hand moisturizer. Dry skin can also harbor germs. Our normal skin contains millions of bacteria. Those are our bacteria. We call it our own body flora. They do not harm us, but a lot of itching can actually cause bleeding, and that is how bacteria can enter the skin. So after using hand gel many times, you might feel like, oh my God, my hands are getting dry. You can wash them with soap and water, and then use common hand lotion that you have. If you like fragrance free, that's great. I like to use simple stuff, the less chemicals, the better. Like Vaseline works best. There is Aveeno, but I'm not into the name branding business, but whatever works for you.
Thank you. That's very useful. In the rephrase it says, will vaccination prevent infectious diseases, and will flu vaccine, COVID-19 vaccine helps? So maybe we can say if somebody has sensitivity to vaccines or any limitations when they are not able to do so.
Yeah.
Any tips you would like to offer?
Certainly, certainly, there are some people. So the flu vaccine, for example, is grown in an egg, right? And so some people may have egg allergy, and as a result of which, they might not be great candidates for the vaccination. Well, my other tips that I shared with you. So, of course, vaccination is great, but if you're not able to take it, my other tips, making sure when you're going in public places, you wear a mask. You might not need one while you are walking out in a park in fresh air. But if you are going to be in crowded spaces, you might want to consider putting on a mask. And you also want to make sure that you're putting it the right way, the way I showed you earlier today, making sure you're cleaning your hands very often. I mean, those are the simple strategies, because if you visualize it, at the end of the day, the bottom line is that we're not going to have any viruses going into our noses or our mouths or through our eyes getting into our body. And so if we are successful in protecting this, making sure our hands are clean, we just might be able to prevent those infections. I have heard about the role of vitamin C and zinc in improving immunity, but then there are so many other eating a healthy diet. I mean, there's so many other things that can also strengthen our immune system.
Thank you. That's very useful. So the next question is very generic, but we can make it more meaningful. How this personal caregiving, system works, and who can, get it? Is there cost involved? What can be the process if somebody starts to look for caregiver? What might be the stepping stones they can take? And to make also sure they are legitimate and so what will be the 101 for that will be very useful.
So for the in-home health services, I think if a person is eligible for that, in the hospital itself, there will be some case management that they will go through their insurance provider to make sure that they are eligible for that, because there are certain criteria that they need to fulfill to ensure that they meet those criteria. Once they meet the criteria and the insurance covers them, then once they are at home, anybody can be the caregiver, but they need to actually go through a process and get themselves certified so that they will get paid for that services. So that could be their own family member, could be their daughters, their husband, wife, whoever can get paid, or there can be outside caregiver that'll come and help them to support that person. And sometimes it's an outside person, the insurance actually pays for that. And as elderlies, most of the time, Medicare, Medicaid, uh, definitely have a process in which that they cover certain hours of services that are provided. And also there are home health agencies that will cover some of the care, like there's a bowel and bladder care that will be provided to the elderly, or they'll just come and do some basic work with them to help them get up, give them bathing activities of daily living.
Thank you. Is there any limitation, like how long can
Yes,
people access?
there is limitation on that depending upon how your insurance coverage is. So there are certain limitations on then depending upon your disease conditions. There is a morbidity scale that they will follow, and it could be like 2 hours is provided, 3 hours is provided, and if you continue to meet the criteria, then you will continuously get that support. But at certain point, there might be something that the insurance would not cover depending upon how their copay and how their insurance is paid.
Thank you. And is there any like financial assistance for people who don't qualify?
Yes, the one that I talked about, the elder care, there are a lot of agencies and there are a lot of non-profit agencies that do support elder people, like spinal cord injury and other conditions. These are lifelong conditions, so there are a lot of organizations that actually have support that they will provide. They'll give wheelchair, there'll be uh, people who are volunteering that will come to the home and provide them with groceries, help them to take outside, or just provide them simple thing like laundry and other things. But everything will depend upon understanding what is their situation and which organization they can connect with.
Thank you. I mean, this is very useful because and this can be very confusing for many to where to begin. So we really appreciate you sharing these resources and giving the background information. There are a bunch of compliments.
Add one more thing. I
Sure.
think it will be important for the family or the community as well as the elders to really connect with their care coordinator or the case manager who actually helps them through that, and the social worker. So they are really key people in ensuring that community services, because depending upon what can be available, and also there are free resources, so they have information for every city or every county that they can provide.
Yeah, and the striking point was, I mean, I kind of knew that family members can get certified and get, become caregiver is much easier to go through, and that's very, very actually intriguing that it can make things much simpler for certain situations.
Yes, it
Thank
can.
you, sir. Uh, Next question is, will you give any skin infections are different types? So which types are more prevalent?
Can see skin infections. And now we talked a little bit about having fragile skin, right? So it could be just a scratching, and that could cause an infection. Or sometimes when we have patients who are diabetic and they are, they end up having diabetic wounds in their feet or different parts. And then there's the surgical site infection. So there's different kinds of infections that we talk about. In terms of surgical site infections, there's this whole, I think I would need a whole different presentation about keeping the skin site clean. And in fact, that is the thing with any kind of infections, but making sure that the skin site is being kept clean and the dressings are being changed in a timely manner. But yeah, those are the kind of infections that we talk about and we see patients. So the underlying cause might be different for different cases we see.
Thank you. The next question is interesting. It says how to boost a strong immune system, and is it related and the food intake will help or no to that?
Yeah, and I can take a little bit on that. I think that there is a lot of fruits and vegetables out there. For example, I briefly mentioned the role of vitamin C. I mentioned the role of zinc. There is also the role of vitamin D, recently emerging, that would help boost immunity. So definitely eating healthy homemade food, cooked food, or raw food, both have a very good impact on health. I think the most important thing with any kind of food is that being consistent with a good diet. So if you're wanting to see changes, you want to be consistent with eating a wholesome diet.
Treated and the vaccines, do they really work for it, especially for the prevention?
Yeah, so there's two doses of vaccines that can be taken for prevention. Your doctor can recommend or order it through your healthcare service. Um, so there's two doses taken a certain time apart. So you want to make sure you take both the doses. But what do you do if you already have shingles? So if you are seeing the complication, I'll tell you my personal story. The complication we had is that day I had given my mother a hot water bag to put on her abdomen, on her stomach. And so that night when we started seeing rash, our immediate thought was that the rash was due to the hot water bag that she had put on her stomach. Well, it turns out the next day the rash just kept getting worse. And so if you go approach your doctor, you can get antivirals. And if you take antivirals early on in your ailment, then the risk for long term, nerve pain and all that is really lowered. And so when you start the onset of rash, you want to make sure you let your doctor know. There's also a lot of other medications available over the counter, at least where we live here. I'm here in California. You get medications to numb the pain because they can be painful. They could be really scratchy. So you feel like they are very itchy itchy. So there's medications you can apply on the surface of your skin, but the doctor can give you recommendation based on where you live, so that you can get the right medication for your concern.
Thank you. The last question we'll take is about face mask. Do you prefer the cloth or the disposable?
Personally, well, I will tell you that it really depends on. This is a tricky question, because when we have face masks, the face masks have certain stringent requirements in terms of the material that is being used to make those face masks. So when you have a hospital grade face mask, for example, there is a strict CDC criteria based on which, like a NIOSH criteria, that that are being used. They are more protective. So if you're going to wear it properly, they will definitely offer you more protection. However, if you're not you don't have that as a resource available to you, you can use your home mask. You want to make sure you're washing it regularly. We all did use that, right, for personal use. So really, the hospital grade masks are more protective. But if you really don't have anything, you can definitely, something is better than nothing, right, to cover your face and nose. So in those cases, you can use your homemade mask or cloth mask.
Okay, so there are two compliments. One is from Vidya Kankala. It's great to learn various ways to prevent entry of germs in our body. What all can one do to enhance our immunity? We already covered that. Then somebody said, I found this webinar incredibly helpful and valuable, especially in addressing key aspects of elder care and preventive strategies. Thank you for offering such a comprehensive session. So thank you those who said that. There is one more question, but there is a poll which needs to happen. So we'll do that. And the question, meanwhile, the speakers can think, is how do nurses handle the emotional and psychological needs of elderly patients?
Federally available free services that they would provide tablets, smartphones, stuff like that with braille options. So there's a link that I put. I maybe Pallavi can add that veterans. So there is just a lot of things available for. They have talking measuring tape. They have talking blood pressure monitors and stuff like that. So they can independently live.
Yeah, we shared it in the everybody. So now, Sejal, you have a couple of more things to add, or you're finished? Yeah, you have.
I think I'm pretty much finished. I initially mentioned, we talked about a little bit about wound infections. We talked a little bit about pneumonia. One of the things that we can really do to prevent pneumonia is improving our physical activity, or making sure we are physically mobile, walking around, because what walking does, or deep breathing exercises, right? Because what it does is it keeps the mucus in your lungs moving, and when it's moving, it's good, right? So that those are the couple of recommendations I can make. Keeping yourself hydrated if water limitation is not an issue, because that also keeps all that phlegm moving. If we're lying down in one place all the time, unless our illness or something prevents us from moving, we all the secretions pool on a certain side of the lung, and then it causes that infection. The other thing to prevent pneumonia is making sure your oral care is taken care of. Basically, brushing your teeth, making sure the mouth is clean, right? So even if we are going to aspirate food going in the wrong pipe, when we are aspirating, it's on a clean mouth versus a dirty mouth, if you will, for lack of a better word. So those are the couple tips I have for pneumonia prevention. And for urine infection or UTI that we call, women are more susceptible because we have a short urethra. Again, making sure personal hygiene, and then drinking fluids. I think those are the two things that again, we want to make sure that it is not against your dietary advice. We don't want to go against that, but if you're allowed to drink water, you want to make sure you drink a lot of fluid. I don't replace your fluid with juices, thinking that juices are not a replacement for the water that you can drink. Juices are not necessarily healthy. It adds to the sugar content. So water intake must be good. Those are the couple things I wanted to add. I mean, there's a lot more we can talk about, but that actually requires some dedicated time and attention.
I was reading into one of the magazines saying, eat your fruit and drink your veggies.
There you go.
Juice your veggies. But anyway, so the last point, our time is coming to end. So maybe both of you give us little bit insight on the emotional and psychological support for the elders, especially those who are lonely or living, loneliness and is a bigger problem as we know. Uh, and the last thing will be then we will recap with some takeaway points, like what will be a capsule message you each would like to give us, and then we will
And
bring
maybe
it.
very quickly touch on chronic patients and those having comorbidity. So, I mean, it's a big topic, though. I mean, just a quick, any,
Yeah, brief,
top of the head,
brief
some quick,
idea.
quick tips on that. Yeah.
Usually, you want me to go first?
I'm about to ask you the same question. I can go first if you're okay. So in terms of chronic diseases as we age, definitely, we start one of the first things we start seeing is that our insulin that we have in our body starts to become resistance. Well, what is insulin resistance? It's basically when usually when you eat food right after a meal, your body produces insulin, and that basically takes the blood sugar out from the bloodstream. So at any given point in time, your blood sugar of course, in the blood is not super high. As we age, we start to develop what is known as the insulin resistance, meaning that insulin does not do the job as well as it was designed to do. So that's one of the issue. The other issue is that we start with, let's say, blood pressure. So we start developing plaques. I mean, and so some of these problems really cause the comorbidities that we talk about, where your lipid profile can go up. So one of the most important thing that we can do to reduce both improve your insulin resistance, reduce triglyceride, reduce your lower your LDL, your bad cholesterol, is really eat raw fruits and vegetables, as you mentioned earlier, but exercising. I mean, those are some of the natural ways where you can reduce your cholesterol, your lipids, and your triglyceride. Some homemade remedies. I know in India, I remember when I went to nutrition school, we were exploring the use of methi, like soaked methi, to improve your blood sugar, your insulin resistance, as well as triglycerides. But modern medicine is not seeing it yet, so I will not go too much into the details. But those are some of the things. And then, of course, you talk to your doctor and see how medication management can help you. I quickly wanted to also tackle the question you asked about elder loneliness. And unfortunately, that is such a sad reality since the pandemic, even more so, where our elders have been pretty isolated. One thing that we can do is talk to people, whoever you interact with. If you are taking care of your elders, your parents, your grandparents, your neighbors, make that first move. Stop by to say hello. When we had that older culture where we would just stop by for tea in the afternoon just because, right? So we're no longer in the pandemic, and on behalf of our elderly individuals here, I would say seek out people to talk to. Don't keep things to yourself. Talk to your family, talk to your friends, talk to your neighbors. Definitely talk to your doctors, because there is a lot of resources available out there to assist. Keep yourself busy. Play a game of checkers with your neighbor. Go out if you have the opportunity to get fresh air. Strongly suggest getting fresh air every day, because fresh air and sunshine can do wonders, and this is proven to be a fact. That it does wonders for our brain. It produces all the right chemicals for us to lead our days. So those are some of the things that come to my mind right now. I'm going to hand it off to Dr. Vangari.
I think she summed everything up. I would say that, according to the World Health Organization, what I've seen is by 2030, 1 in 6 person is going to be 60 years and above. And loneliness, they're saying, is going to be number one because of all the tech world that we are in. We're trying to be more lonelier than trying to be more connected with people. So I think that's something, as you mentioned about loneliness. I think that loneliness is going to be more common. And 1 in 6, they say, older adults will experience abuse from their own caregivers. Because if you're lonely, your family is not there. That means who's going to take care of you? Somebody outsider, right? And that outsider is not your own person. And most of us over here, I see, are Indians, and we are so connected, right? We really want our own people taking care of us. And even if they abuse us, we still love them. But an outsider, whatever they do, is not going to be helpful. So I think for loneliness, the most important thing is to really be connected to your own people and really have that connection from the childhood, so that that don't put me in the nursing home, but we want to be connected. Like put that culture in your children, so that when you grow old, you're going to have a family to be with. Because I think that's where, because I've worked in nursing homes, and I know that how much the elderly people long to be in the family. So I think that connection is so crucial and so important for them to really thrive. People can live longer. It's not the medication, it's really not the food, it's nothing, but it's that connection and that thing that I am wanted. I'm wanted, I'm loved. It's something very, very important, and that gives you that thrive to live longer. Then you start eating and everything. I think that's what I would say, that loneliness is really not good for anybody. So I think get connected, and if you don't know somebody, there are resources. So just seek out, and because you don't want to get into a situation where you will not be someone that and I think it's not just the elderly. I think the other people also have to connect with them. Just everybody should take the responsibility, like each one reach one.
Thank you. That's the very highlight of your talk, because that's what our vision is. And thank you for affirming, because nobody should go through the hard times and suffering, and should deserve good quality of life, whatever it is. And even we were not aware of so many beautiful things you offer, and through your organization, we are very delighted to have a affiliation, partnership, collaborate with you, and I'm sure a lot of good things will come out of this. And from the audience, a lot of good comments and good remarks. Everybody seemed to enjoy. So those who are in the audience, please share your feedback about the session with us, come and volunteer with us, and also support us by your generosity, so that we can do a lot more of this. And I guess Veena wanted to say something
Yeah,
last.
I just wanted to make sure that I don't miss that, because I am here. Say, Dr. Sejal is here because of Baina. So we want to make sure that our organization is something that we want to not really market, but we want to say that we are part of the Bay Area Indian Nurses Association. We're all heritage of Indians, and we are basically, as it says, bridging the cultures, caring with excellence. So we're all professional nurses. We're trying to be connected with the community. Our goal and our mission is to really connect with the community, but also be very professional and work with the evidence-based practice, not just what we have heard and learned and on traditional things, but also what is really evidence-based and scientifically proven.
Yeah,
And we would
that
like to
very
connect
much
with, yes,
converges with the vision and the mission of Crack the Wellness Code. So very glad to partner with you. And thank you so much.
you're welcome. Thank you.
This is our pleasure to be here. Thank you.
Thank you.
All right, thank you. That was very nice. Any last one takeaway you want to say? Just one thing people to remember.
Say treat yourself well,
Ah,
and treat others well. You never know what people are going through in their lives, and so treat others like you're treating your own self. Um, and that is my takeaway message.
yeah, that's very
We say our
powerful.
bodies are temple. Our bodies are our temple. So let's treat them like that.
Beautiful. I like it. Veena, you want to
I really like what Sejal said. I think I would say that, your words are really healing to your
Mhm.
bones and your soul. So I'm guilty sometimes. I get angry. I speak negatively sometimes. But I think the more positive you give out, the more positive will come back. So I think your words are healing. And it's, I think it's very important for us to use our words very positively to impact others as well as to impact your own self and forgive others. I think that's very key for our healing.
Yeah,
Well said, Veena.
thank you so much.